Suicide is a worldwide known condition that is mostly caused from depression. The suicide rate has risen from 11 per 100,000 people to 13 in the last 7 years. Usually, younger adults have more serious thoughts on suicide from ages 18 to 25 than many of the older adults 26 to 49. Suicide is one of the many public health problems. It affects many families every year, and it's an issue that the public continues to ignore. People who suffer from depression are more at risk for suicide, but some treatments, such as antidepressants and therapy, have helped. Medical illness is 25% of why many people commit suicide. Depression creates a tendency to see problems in black and white situations. Depression is a wide range of conditions that affect your mood, thinking, and behavior. Some of the symptoms include getting less hours of sleep, eating less, and also speaking less. Compared to normal sadness, grief, loss, those go away, but depression is different. More than 80% of people with depression improve once they get treatment and medication. Most people who fall into the stage to think about suicide usually have lost something most important to them, such as a family member or a really close friend of theirs. Over 32,000 adults have committed suicide, but only a fraction have attempted or considered it. Women make nearly 4 times as many suicide attempts as men. Men use things like guns and things that are violent, and women use things such as pills based on studies. There are many more causes of suicide other than depression, such as sexual abuse, being in prison or jail, family violence, and other medical illnesses. Of the adults who have attempted suicide in the past year, 62.3% have received medical treatments for their attempts.
The main ways that people will try or possibly commit to is by jumping off bridges, placing guns to their head, overdosing on non-prescription drugs, and another common way is by slitting their wrists. There are many websites that try to prevent suicide from happening. Some of them have hotline numbers you can call if you're ever thinking about suicide. Suicide is basically like follow the leader. Once one person commits suicide, more people are going to think it's okay to commit it. Being alive is a gift, and people should not just throw it all away. You can get help just by doing a few steps at a time rather than hurting all the people who love you the most. Mental disorders such as depression, bipolar disorder, personality disorder, anxiety disorder, and substance abuse such as alcoholism are risk factors for suicide. If you suffer from any one of these disorders, you may want to get the help you need before you end up hurting yourself or anybody else. It is a leading cause of death in the United States, and it has a lasting effect on your loved ones. If you have any loved ones with depression and may be thinking about taking their own life, even if they tell you they are fine, they are not, and it is your responsibility to take action to help them. According to CDC, men are more likely to die from suicide than women, but women are more likely to attempt it. Suicide is a leading cause of death for ages 10 to 14. The more stress that is on you can cause you to start giving up on things you've been working so hard for. Some warning signs include using alcohol or drugs more often, acting very anxious and aggravated, withdrawing from family or friends, talking about hopelessness and having no reason to live, and many more. The WHO estimates that every year around 1 million people die from suicide, which is 16 people per 100,000 or 1 death every 40 seconds. In the last 40 years, suicide rates have increased by 60% all around the world. Even though suicide seems to be the most common in young adults, it's the highest in the people over the age of 65.
There are many different ways that you can help or prevent yourself or anybody else that you know who goes through this disorder, but you have to take the time to get the help that you need, even if you don't want it. It would be better for your health than you could stop anybody else who needs it.